Hello everyone, this is Alice Blue. This presentation is on the urinalysis and microalbuminuria interpretation in clinical practice. I just wanted to give a few key tips here at the beginning on specimen handling and preservation. The urine should be tested within 2 hours, or if refrigerated, it must be warmed up to room temperature prior to testing.
These are some reasons why it's so important to make sure your urine specimen has been preserved correctly. You can see that there can be some decreases in levels, some increases in levels. So it's pretty critical that you're not interpreting a specimen that's been sitting out a super long time, or a specimen that maybe you gave a patient a cup to go home and bring it back. You need to make sure you educate them on how to preserve it. Maybe go home, make the specimen and bring it right back in. Otherwise, don't really rely on it for total accuracy. Okay.
It's a good practice to go ahead and examine the urine. You want to look at the volume, the color, check for odor, and check appearance. Pretty much any clinic you go to, you're going to be able to find urine dipsticks. They're inexpensive, they're simple to use, they give you a rapid result with good diagnostic information. So urine dipsticks are very simple, but sometimes that simplicity can lead us to some problems. There's just some general laxity when using urine dipsticks. Sometimes you can have some subjective calls from whoever is running the urine. You can have some relaxed quality control and just some overall dipping errors. Maybe not quantity, maybe they didn't dip it long enough. Anyway, so there can be some issues. This slide just gives you a quick review of the normal reference ranges that you would see from a urine dipstick. So for the first level that we're going to review that you'll see on a urine dipstick, that's going to be the glucose. Normally the glucose, if you recall, is reabsorbed by the proximal convoluted tubule in response to the body's need to maintain an adequate amount of glucose. If you have hyperglycemia, the tubular transport of glucose will stop, and so you'll end up with excess glucose in the urine. It's important to check for glucose if you're looking to monitor diabetes or if you're looking to detect diabetes. It can also be used to follow up with a serum glucose and a hemoglobin A1C. This just gives you a few causes of false positive or false negative results for your glucose. So we know that bilirubin is the breakdown product of hemoglobin. It can cause the urine to be a yellow-brown to greenish-brown color. There may be some yellow foam. It's most often associated with liver disorders, but you can also see it if there's some biliary tract obstruction. Here are a few issues that you may see leading to false positives or false negatives in your bilirubin result. So if you recall, ketones are a metabolite of fat utilization, can indicate the presence of acetylsalicylic acid, which is associated with the utilization of fat for energy. So it's very common to see this if you have decreases in intake of carbs. So keto diet folks, they're trying to meet a state of ketosis, so it's very, expected to see ketones in their urine. Can also be seen in diabetes, prolonged vomiting and or diarrhea, and in starvation or malnutrition. And these are just a few reasons why you may have a false positive or a false negative result in your ketones. The specific gravity of the urine is basically telling you the density of the substance compared with the density of a similar volume of distilled H2O at a similar temperature. So the normal range can absolutely vary, but it basically signifies the concentration of urine. An increase in the specific gravity of your urine can indicate dehydration, hepatic disease, or CHF. A decrease in the specific gravity may indicate pyelonephritis, glomerular nephritis, polydipsia, or diabetes insipidus. Hematuria means that you've got intact red blood cells in the urine. You always want to follow up with a microscopy to check, is it just RBCs or are there RBC casts, which definitely, would indicate that you've got some bleeding from the kidneys. So they can be indicative of disease or trauma to the kidneys, which is seen in calculi, cancer, infection, and other things, bleeding disorders, excessive exercise, and then of course don't forget about our women. Menstruation can absolutely cause some hematuria, so you don't want to miss that in this diagnosis. If you have hemoglobinuria, basically that means hemoglobin in the urine due to intravascular hemolysis. It can also occur with excessive exercise and extensive burns. Myoglobinuria, which means there's myoglobin in the urine. It's acute destruction of muscle cells, and it can also occur with strenuous exercise. And here you just have a few reasons for why you may have a false negative or false positive result in your urine for blood. So the pH in the urine can vary a little bit. Acidic urines, we're looking for possible causes there, which could be high protein diet, diabetic ketosis, UTI, specifically E. coli, respiratory or metabolic acidosis, or prolonged vomiting or diarrhea. Alkaline urines, are common in vegetable diets, in UTIs caused by Pseudomonas and Proteus, and then in respiratory and metabolic alkalosis. So I'm sure you're starting to see a trend here, some reasons for false positives and false negatives, or false increases or decreases for pH. So you always want to make sure that your specimen has not been sitting out for too long, because that tends to cause problems in pretty much any one of your results, including in the pH. So the protein level in the urine dipstick, the strip primarily detects albumin. Albumin presence in the urine can be an early indicator of renal disease. It can also indicate multiple myeloma, preeclampsia, diabetic neuropathy, emotional stress, strenuous exercise, orthostatic proteinuria, and many others. And a few reasons for possible false positive and false negative protein. Moderately increased albuminuria, formerly known as microalbuminuria, it's not always identified with your standard urine dipstick. The standard urine dipstick is least sensitive and specific for the determination of albuminuria. And to be positive for moderately increased albuminuria, you've got to have a persistent elevation above 30 grams per day. Transient elevations can be seen in times of stress and illness, such as with fever, infection, exercise, heart failure, elevated blood pressure, hyperlipidemia, and an A1C is greater than 8. The 24-hour urine collection is the gold standard for the detection of moderately increased albuminuria. And remember, vigorous exercise can cause a transient increase in albumin excretion. Moderately increased albuminuria is tested among diabetic patients when you're screening for cardiovascular disease risk, and to look for changes over time that could indicate the presence of nephropathy. Urobilinogen is the degradation product of bilirubin. It's normally found in small amounts in the urine, and its significance can indicate liver disease or a hemolytic disorder, such as an increased rate of red blood cell destruction. And again, just a couple of reasons why you may end up with a false positive or a false negative result. All right, so nitrite. Nitrite is the reduction product of a naturally occurring nitrate produced by bacteria. It suggests the presence of bacteria, microscopic bacteria, and white blood cells. You can do a follow-up with a bacterial culture and sensitivity if you have positive nitrite to identify the organism and the appropriate antibiotic therapy. A negative test does not necessarily mean the absence of bacteria. Inadequate incubation period of bacteria in the bladder can occur. Bacteria unable to reduce nitrate to nitrite can occur. Bacteria conversion of nitrate to nitrogen can occur, and sometimes you can see changes if there's no nitrates in the diet. And just a couple reasons why you may have a false positive or a false negative result. All right, this is the last level that we check on our urinalysis, the leukocyte esterase. It's associated with the presence of white blood cells, and most of us know this at this point in our nursing careers. Definitely an indicator of a UTI being present or urethritis in men. Microscopic white blood cells and bacteria, and then again you can follow up with a bacterial culture, and usually I do that with a sensitivity report if you have a positive. or if you have a negative, because occasionally you can sometimes see a negative leukocyte estrase and still have a UTI. All right, and this is our last slide. Here's some reasons why you may have a false positive or a false negative result on your leukocyte estrase.